Melatonin sales in the US have more than doubled since 2017 to over $830 million a year. In the UK, where you can only get melatonin from your doctor, prescriptions have risen exponentially in the last 10 years to over 1.1 million a year. So why is melatonin so popular? Could it help you sleep? In this video, we focus on melatonin for adults with poor sleep. What's the latest evidence on formulation, dose and timing? Part 3 is all about kids, and in part 4 we'll look at melatonin for jet lag and circadian rhythm disorders. In the first video of this series, we learned that melatonin is a hormone with many talents. It's produced by the pineal gland at night and performs a huge range of functions in the brain and body, including cueing the timing of sleep. As we get older, melatonin levels fall dramatically. When it comes to tackling insomnia, melatonin is rarely the most effective option. In the UK, the evidence gurus at NICE recommend cognitive behavioural therapy as a first-line treatment. But they do say that treatment with a prolonged release melatonin may be considered for adults over the age of 55, at a dose of 2 milligrams once a day, 1 to 2 hours before bedtime for up to 13 weeks. There are a whole bunch of important warnings which we'll come back to. Melatonin supplements are a synthetic version of our natural hormone. There are broadly two main types. There's prolonged or extended release, which is what NICE mentions, and there's immediate or fast release, which is most of the stuff you buy over the counter in the US. This study looked at what happened when healthy working age adults took 4 milligrams of immediate release or extended release melatonin. The immediate release formulation gets into the bloodstream within 15 minutes, with levels peaking in 40 minutes and then quickly declined. The extended release formulation had a lower peak after 2 hours and levels stayed elevated for longer. The precise patterns will depend on the brand and dose, but in general, immediate release melatonin is designed to help people fall asleep more quickly. Extended release formulations more closely mimic the natural pattern of melatonin release, so it's more likely to have an effect if you wake up during the night. A risk with extended release melatonin could be if you take it too late at night or your body doesn't clear it fast enough. It might make you feel drowsy the next day. This study showed that a 4 milligram dose leads to much higher serum levels of melatonin than you'd ever get naturally. A healthy adult pineal gland might get you up to 100 picograms per milliliter at night, and yet in this study, the average peak was 12,000 picograms per milliliter, 120 times higher. Doses of a milligram or more are supraphysiological, more than what you'd find in the body naturally. There's huge variability in melatonin's bioavailability, how much of what we actually take in from a pill becomes active in the body. It's hard to know how your body will respond, which is why it's always a good idea to start with the lowest effective dose. How little melatonin do you really need to have an impact on sleep? Ooh, this is interesting because we can't talk about dose without talking about timing. Studies in healthy young people have found that as little as 0.1 milligrams of melatonin taken before midday could make healthy people feel drowsier. Lower doses may have a more reliable effect on shifting the timing of sleep. When it comes to improving sleep at night, a 2024 meta-analysis combined the results of 26 randomized controlled trials to try and work out how much and when was the best time to take melatonin to fall asleep faster or stay asleep for longer. On average, melatonin supplements helped adults fall asleep 9.3 minutes faster and stay asleep 19.7 minutes longer, so not huge effects, and it was less effective for insomnia sufferers than healthy people, in line with previous research. This dose-response curve shows that on average, increasing the dose up to around 4 milligrams helped people fall asleep faster. But taking more than 4 milligrams actually became less effective. So 10 milligrams had a similar effect to taking 1 milligram, perhaps because taking too much actually makes melatonin receptors less sensitive. In terms of when to take it, researchers concluded that you need to take it early, at least 1 hour and up to 3 hours before sleep. The authors suggested that you need to give enough time for melatonin to start lowering core body temperature before you can expect sleep-inducing effects. Interestingly, there was no difference here between immediate or prolonged release melatonin. In terms of helping you stay asleep for longer, again, the dose-response curve shows that the peak response is between about 3 and 4 milligrams, after which taking higher doses gave no additional benefit to total sleep time. So all those jars of melatonin which promise a super strength 10 milligram effect, Analyses of commercially available melatonin tablets has also revealed that what they say on the label may not be what is inside. One study found the tablets inside contained -83 to +478% of what was advertised. Melatonin is sold in the US as a dietary supplement, not under FDA scrutiny like other over-the-counter or prescription medications. A USP verified mark can give you some reassurance that the product contains what it says it does, but very few melatonin supplements carry this accreditation. Melatonin side effects are usually mild: headaches, back pain, dizziness, nausea, sleepiness, and will stop when you stop taking the drug. Higher doses of 10 to 12 milligrams might be prescribed to reduce the symptoms of REM behaviour disorder, where people act out their dreams. And in specialist clinical trials outside of sleep, ultra-high doses of up to 100 milligrams of melatonin may be given to try and harness anti-cancer or anti-inflammatory benefits. But we don't know yet what the long-term effect of this will be, so please don't try this without medical advice. Other hypnotics like benzodiazepines have some nastier side effects such as dependence and tolerance, which melatonin doesn't seem to have, so it is seen as a safer alternative. However, for some patients, such as those with cognitive impairment, melatonin's side effects could be more dangerous, triggering mood disorders or next-day psychomotor slowing. There are also drug interactions to look out for, such as those on blood-thinning drugs or antidepressants. Contraceptive pills, HRT, and alcohol can also slow the rate of melatonin clearance. The bottom line is that melatonin may be a natural hormone, but this doesn't mean that it's risk-free, or even that it will work for you. I strongly recommend that you speak to your doctor or healthcare team before you take melatonin, or any substance to help you sleep. I feel like that's important to emphasise, so I'm going to say it again.
I strongly recommend that you speak to your doctor or your healthcare team before you take melatonin or any substance to help you sleep.
Crucially, speaking to a doctor could help you to understand why you're having sleep problems and whether melatonin is really the most effective solution, because often it isn't. For example, for insomnia, ideally you want to start with CBTI. Getting to the root cause of sleep problems is especially important when we're talking about children, which is the subject of part 3. Thanks so much for listening, and sleep well.